Knock knock. Hi, my name's Rachel. I'm gonna be your nurse today. We're just gonna be doing a little health assessment. It's gonna be like 15 to 20 minutes. I noticed you have your family here with you today. If you want them to leave, you will be uncovered for portions of this exam, so they can definitely head out, or if not, we can just get started. Before we start, is there anything you need? Like, do you need to use the restroom? Are you in any pain, or do you need water? Oh, no? Okay. And then can I get your name and date of birth? And then do you have any allergies that I should be aware of? Perfect. Okay. And then just a couple more questions. Do you know where you are today? Oh, these are already up. Great. And then do you know what day it is? Okay. And then just in your own words, can you reiterate what you're here to be seen for today? Oh wow, this is really slow. Perfect. Okay, so if you'll give me a second, we'll get started here. Okay. Okay. Oh, just make sure your brakes are locked. Okay. Oh man. Jeez. All right, so we're just gonna start with your head, your scalp, just making sure there's no bumps or anything, and your hair is evenly distributed. Your skin looks great. Everything is good. I'm just gonna whisper 3 words in your ear. Go ahead and repeat them back to me if you can hear them. Okay? So, oh,
You can just lean over.
okay. All right. Perfect. Okay. Sounding really good. And then go ahead and squeeze your eyes shut really tight. I'm gonna try to open them really lightly. Just don't let me do that. Perfect. Okay, and then give me a really big smile. And then go ahead and puff your cheeks out. Perfect. And then I'm gonna feel along here your lymph nodes. And then here as well. Go ahead and clench your jaw for me. Okay, everything looks really good. Your skin is looking good. Everything's looking symmetrical. We're gonna look at your eyes and your nose and your mouth really quick. This is gonna be a light in your eyes, so before I do that, do you or anyone in your family have a history of seizures? No? Perfect. Okay. So go ahead and just look straight ahead. Okay. Okay. And then go ahead and follow my pen light. Okay, and everything's looking really good. And then can you just read my name badge really quickly? Perfect. And looking at your eyes, sclera looks normal colored. So everything's looking really good. I'm looking at your nose now. I'm checking for patency. I'm just gonna close this side. Oh, it doesn't go. All right, I'm just gonna close this side. Go ahead and take a breath for me. And again. Perfect. All right, and then we're gonna look in your mouth. Go ahead and open up. I'm just looking at your tongue, your mucous membranes. Go ahead and say ah. Just checking to make sure your uvula rises midline, and it does. Everything's looking really good. Do you see a dentist regularly? Okay. And when's the last time you saw a dentist? Perfect. Okay. everything's looking really good. We're gonna move on to your neck. I'm not noticing any jugular vein distension, so that's looking really good. Your trachea looks midline. Everything's looking very symmetrical with your face and your neck areas, so that's great. I'm just gonna feel your thyroid, but before I do that, do you or anyone in your family have a history of hyperthyroidism? Perfect. Okay, so I'm just gonna feel this and then go ahead and swallow for me. Okay, perfect. Everything's looking really good. And then go ahead and shrug your shoulders against my hands here. Perfect. I'm gonna clean my stethoscope really quickly, and then I'm going to listen to your carotids. When I put my stethoscope on your neck, just go ahead and hold your breath for me. Okay. Okay, go ahead and hold your breath. And again. Okay, everything's looking really good. I'm gonna move down to your chest now. So I'm just gonna uncover you really quickly, make sure and cover you right back up. We'll get this done as quickly as possible. I'm just looking at your skin, making sure everything looks really symmetrical and I'm not noting any scars or anything. Everything looks really good. Looking at the effort and rhythm of your respiration, that looks pretty normal. So I'm just gonna be listening to your lungs and your heart. Have you or anyone in your family had any history of like heart problems, like stroke, heart attack, anything like that? Perfect. And what about any respiratory problems? You got any trouble breathing or anything? Perfect. All right, so we're just gonna listen to your lung sounds first. Okay, go ahead and take a breath for me whenever I put my stethoscope on you. And then along the side. Okay, everything sounds really good. We're gonna do your heart really quickly as well. You don't need to do anything for that. I'm just gonna listen. And then while I'm here, I'm also gonna just palpate your radial pulse for a full minute, just to make sure everything is matching up. And it is. Everything looks really good. So I'm gonna cover you back up, and then we're gonna take a look at your at your abdomen. Again, I'm just looking at your skin, making sure everything looks symmetrical. I'm not noting any scars or pulsations. Have you had any trouble? Oh, and the contour of your stomach is looking pretty flat. Just a little bit around this, but it looks pretty normal. Have you been having any issues with like your bowel movements or eating recently? No stomach problems? Perfect. Okay, so I'm gonna listen to your bowel sounds first, and then I'm gonna palpate. When I am palpating, just let me know if you feel any pain, okay? Okay. And again, just let me know if you're feeling any pain. Okay, no pain? Perfect. All right, so I'm gonna cover you back up. And then I'm gonna go ahead and look at your arms. Again, just looking at your skin and making sure everything is looking really symmetrical, which it is. I'm not seeing any lesions or anything abnormal. I'm just gonna squeeze your fingers, check your capillary refill, and then I'm gonna take your pulses. Okay. Go ahead and grasp my hands firmly. All right, and then push against them and pull back towards you. All right, everything looks good. Same thing with your legs again, looking for symmetry. I don't know if I said this earlier, but I was looking at effort and rhythm of respiration.
You did.
Okay, perfect, just checking. Okay, same thing with your legs. I'm looking at symmetry, looking at your skin, making sure everything looks normal for your ethnicity, and it does. Again, I'm taking your pulses simultaneously here, checking your capillary refill. Again, just push against my hands here, and then pull back against them. Perfect, okay. I'm gonna leave this down because we're gonna be having you sit on the edge of the bed here. Let me lower the bed first. Oh, I have to turn this back on. And then when I have you sit up, just go ahead and like hold on. I just wanna make sure you're not dizzy or anything. And make sure your feet are both flat on the floor. So I don't want you falling. And while you're sitting up, I'm just gonna change my gloves out really quickly. You're not feeling any dizziness or lightheadedness? Perfect. Okay. Oh gosh. So sorry about this. Okay, so we're gonna be doing the same thing on your back. I'm just gonna be listening to your lung sounds again. And then doing a couple other things. And then I'll take you through some range of motion exercises. So, let's see. Yeah. All right, go ahead and again, just take breaths when I put my stethoscope. Breathe. On the sides here. Okay. Everything sounds really good. I'm just gonna you're gonna feel my hands on your back. Go ahead and breathe all the air out of your lungs, and then take a really deep breath in. I'm just checking to make sure everything's symmetrical here. And same thing, I'm looking at the symmetry of your spine. It's all midline, looking for symmetry of your back, and everything looks really good. Don't see any scars or anything. I'm gonna check around your kidneys really quickly. Go ahead and let me know if you feel any pain, but you're just gonna feel a couple hard taps really quick. So go ahead and just, any pain there? Okay, same thing here. Any pain? No? Perfect. Okay. So while I'm cleaning my stethoscope one more time, we're gonna do some range of motion exercises. You're just gonna follow what I do. I just wanna make sure everything's, working the way it's supposed to be working. Okay. All right. So we're just gonna start with our neck. We go back and forth, one side to the other, to your ear to your shoulders. Move your shoulders up and down, and we'll circle. Same thing with your arms out. Rotate your wrists a little bit, your fingers out. Lean forward as far as you can, and same thing, backwards as far as you can, to the side. And then bring your leg up. We're gonna do extend your knee, rotate your ankles. Everything looks really good there. Same thing with the other leg. If you need to, you can hold onto the rail for balance. Okay, everything is looking really good there. The last thing I want you to do is to walk across the room and back. I'm just gonna be watching your balance and your stride. Okay, and that looks really good. Go ahead and hop back into bed there. If you're feeling okay, that's it for now. I'm checking the environment for cleanliness and safety. Your call light's here. Let me cover you back up, actually. Sorry about that. You got all your personal items nearby. If you need anything while I'm gone, go ahead and hit your call button. And I should be back in about half an hour to check on you. And I think that's all for now.